Welcome to the all viewers and well-wishers of the world. Purpose of my lecture is learn the knowledge from the world and return the knowledge to the world. Motto of my life is learn, earn and return. I have learned a lot, earned a lot, now to return a lot to the world. The topic of today is Piebaldism and hypomelanosis, hypopigmentation. Disorder of the hypomelanosis, these are of four types. Number one, genetic. Number two, acquired. Number three, eczematous or papillosquamous. And number four, the miscellaneous. So we are discussing the different topics. The first is genetic. It consists of albinism, vitiligo, piebaldism, nevus depigmentosis, and tuberous sclerosis, which is also called ash leaf macule. Number B is acquired type of hypomelanosis. These are chemical leukoderma and it includes phenolic compounds causing the chemical leukoderma. Now, third is eczematous or papillosquamous. It includes pityriasis alba and pityriasis versicolor. And fourth, D type is miscellaneous. It contains idiopathic gutted hypomelanosis. So, first we are going to discuss the disorder of the hypomelanosis, which is Waardenburg syndrome. It is a rare genetic disorder with a white four-lock areas of the leukoderma, congenital sensory neural deafness, heterochromia of the iris, and lateral displacement of the medial canthi are the features seen in this syndrome. Other features are flattened nasal bridge, confluent eyebrows, hypoplasia of the nasal ali, and speech impairment, presence of the cleft palate or the palate, cleft lip or the cleft palate, and various skeletal abnormalities. It is inherited in an autosomal dominant fashion, though autosomal recessive inheritance sometimes seen to cause this Waardenburg syndrome. Here one can see the broad nasal bridge and the other features which I have already told you, and that is the piebaldism, the pattern of the just having no melanin here, and one can see here in the abdomen also. So these are all the features which can be seen in a condition called Waardenburg syndrome. And other feature of the Waardenburg syndrome are there is white forelock, as one can see here also, hypoplastic ali, and short phantom, and here again one can see the piebaldism and the flat nasal root, heterochromia, aridez, and dystopia, canthorum, hypochromia, aridez. These are all seen here, and these are all the features of Waardenburg syndrome, which is basically a hypomelanosis disorder. Now, the other disorder of the hypomelanosis is ash leaf spots. There are oval ash leaf hypopigmented macules are the earliest cutaneous sign of this tuberous sclerosis. Such light patches occur at birth or in the early infancy. Although tuberous sclerosis is an autosomal dominant disorder, spontaneous mutation can occur in 50% of the new cases, and they are multiple, 2 to 3 centimeter in size and irregularly scattered on the body like trunk and extremities. Macules are lancet shaped or confetti like or irregularly shaped, sometimes a wood's lamp or wood-like examination show macules and identify them in the fair-skinned patients. Here one can see the ash leaf spots on the abdomen, and this is tuberous sclerosis, and one can see also these kind of spots on the foot and the other parts of the body. So these are hypopigmented macules. Size vary from 1 millimeter to several centimeter, as one can see, and the shape is ash leaf, and here it is the ash leaf, the resemblance that is of with the lesions, and it is seen prominently under the ultraviolet light. So these are all the features of tuberous sclerosis or ash leaf spots. They resemble nevus depigmentosus, a single stable, well circumscribed hypomelanotic macule present at birth. Other cutaneous signs include facial angiofibromas, adenoma, sebaceum, fibrous plaques on the forehead, gingival fibromas, shagreen patches, connective tissue hematomas, periangual fibromas, Conan's tumors, and connective tissue nevi, shagreen patches, and systemic manifestations include seizures, intellectual disability, cardiac rhabdomyomas, renal angiomyolipomas, and cysts are also seen. Retinal nodular hematomas and the pulmonary cysts are also present in this condition as association. Imaging studies of the brain shows cortical tumors or subependymal nodules pathognomic for the tuberous sclerosis. And here one can see the ash leaf spots, hypopigmented macule. The average size is 1 to 3 centimeter, and the common shape are oval, polygonal, and lens ovate, whereas the less common shape on the dermatomal and confetti-like, as one can see and appreciate. Here one can see the ash leaf macule. These are reliable early cutaneous sign, and shagreen patch, as one can see here, that is the late manifestation, but early manifestation is just this spot, which is ash leaf like spot and hypopigmented spot. And skin signs in tuberous sclerosis, epilepsy, adenoma, sebaceum, angiofibroma, red papule on the face containing many blood vessels, as one can see here, and lot spots here, shagreen spots, patches of the skin with an orange peel texture on the back, as you can see, and ash leaf spot, white area of the skin that look like an ash leaf, and here one can see that. So these are all the features of tuberous sclerosis. Teacher asked a question from a medical student that if a nuclear weapon is used, who will survive? The medical student said SLE patients, because they have anti-nuclear antibodies and that can combat the nuclear weapon if that is being used. So only those patients which have these antibodies will able to survive. Now, hypopigmentation, it is the disorders of hypopigmentation. It can be divided into 4 major categories. This type of classification, that is diffuse, circumscribed, linear, and guttate. First, we are going to discuss the diffuse pigmentary deletion, and it contains oculocutaneous albinism, Hermansky-Pudlak syndrome, Shediac-Higashi syndrome, generalized total vitiligo, and inborn error of the metabolism like phenylketonuria. So that was diffuse. Now the B type is circumscribed. It is of two types again, acquired and congenital. Among the acquired, vitiligo, chemical leukoderma, leukoderma of the scleroderma, and leukoderma of the melanoma. These are all the acquired circumscribed problem. Post-inflammatory hypopigmentation, that is atopic dermatitis and sarcoidosis, systemic lupus erythematosus, mycosis fungoides, pityriasis versicolor, secondary to the malassezia species infection. That was all acquired. The other is congenital. Circumscribed area of the hypomelanosis include nevus depigmentosis, a common tan birthmark with a partial decrease in pigment, Piebaldism, Waardenburg syndrome, ash leaf spots of the tuberous sclerosis with a partial decrease in the pigment. I have already discussed these things. Nevus animecus, a localized area of the vasoconstriction. Now, the third type of the hyperpigmentation is linear hyperpigmentation. It consists primarily of the knee-wide conditions like knee-wide linear hyperpigmentation, hypomelanosis of segmental or systemized nevus depigmentosis, benign, in which streaks of the hypomelanosis follow Blaschko's lines, an embryonic development pattern that involves all layers of the skin and clinically apparent in the setting of the mosaicism. It is not depigmented as the name suggests, remains stable in size, grow in proportion to the patient growth. A minority of the patient have central nervous system and musculoskeletal abnormalities also in these conditions. Now, the fourth variety is gutted, and it can include idiopathic gutted hypomelanosis, a type of the gutted hypopigmentation, a benign acquired disorder characterized by the small, well-demarcated, hypopigmented macule, measures only 2 to 4 millimeter in diameter. Gutted mean raindrop leukoderma, round white macules, site for this common age-related disorder due to the chronic sun exposure on the shins of the legs and extensor surface of the forearm, so the lesions are seen more on these parts. The patches are asymptomatic and can resemble vitiligo. Women are more commonly affected, and confetti macules of the tuberous sclerosis, and treatment is not necessary until cosmetic reason. So here one can see the idiopathic gutted hypomelanosis. One can see the small spot of hypopigmentation here, and again here the small spots of hypopigmentation on the back, and here these are on the leg. And the idiopathic gutted hypomelanosis, again one can see the small rounded patches of hypopigmentation here and here, the multiple small sized patches seen on the buttock and on the back also.